Well, we take them when we have infections to try to stop those infections, but medical experts now say antibiotics are being overprescribed for everything from the common cold to coughs and sore throats. And researchers say that may be leading to the rise of drug-resistant superbugs. With us now, Dr. Jennifer Levine from Bellevue Hospital here in New York City. This superbug, first of all, explain to our viewers what that is. It's a very serious problem.
A superbug refers to specifically drug-resistant bacteria. What happens through the processes that we know from Darwin of natural selection is that when we keep giving antibiotics, the only bugs that are able to really live are those that are able to withstand the assault of the antibiotic.
Survival of the fittest.
Exactly. So only those bugs are able to survive, and they are resistant to almost every antibiotic.
So we're getting to the point where we're using antibiotics so much that we kill off everything they can kill off, and we're left with these superbugs which expand and multiply and multiply and multiply, and we don't have anything to kill them with.
Yes.
So
yes.
These doctors in the United Kingdom are now saying what exactly? The researchers?
Well, they're saying a number of things. I think one is more of like a public health campaign that we kind of need to make the American public more aware that colds and the flu are not caused by bacteria, they're caused by viruses, and viruses don't respond to antibiotics. So that if you have a cold or a minor sore throat or the flu, that's not the time to take antibiotics.
How much of this is the consumer's fault? In this case, the patient's fault, or maybe the advertiser's fault? Because you see something on TV and you go to the doctor and say, hey, give me some of this.
Well, in the sense that the people who are coming to the doctor have like self-selected themselves as being sick, right? And if you take time off from work and you're not feeling well, you want something that's going to make you better as quickly as possible. And for most people, they associate being sick with needing an antibiotic.
But really what you need if you have a cold, right? I mean, you need plenty of fluids and some rest.
Right, rest and
not
fluids.
A pill.
Right, rest and fluids and symptomatic relief. So you could take, you know, something like Tylenol if you have a headache, or, you know, some of the over-the-counter stuff if you don't have a lot of other medical problems. But yes, for a virus, you need symptomatic relief.
All right. You would think that the doctors would check to see if you have what you have before they decide to prescribe you an antibiotic.
In all honesty, sometimes it's very difficult to tell, and often that involves a culture which takes time to come back. So
it's a just-in-case pill sometimes.
Yeah, but we'll have to be changing that soon.
Yeah, sounds like it. Dr. Levine, thank you.
You're welcome.
All right.